Hello, this is John, and today I'm going to be talking about acute lymphoblastic leukemia for my oral report. We'll be going more into T cell leukemia, although there's many kinds of different leukemias. Lymphocytic, lymphoblastic leukemias are one of hundreds of different kinds you can get, each which have their own unique treatments and prognosis, but then they have their similarities too. Like, what is leukemia? Well, Luke is meaning white. If you take your medical terminology, emia pertains to blood. So leukemia is an excessive amount of white blood cells in the blood. Now, lymphoblastic, it pertains to lymphocytes or lymphoblasts. Um, And there's also and there's lymphoblastic lymphoma, which is really similar to leukemia, but it has to do with the cancer with the lymphocytes, although it doesn't originate in the blood or the bone marrow. Instead, lymphoma is in the lymphatic system, and treatment is often that you would have to be treated till the end of life, as opposed to with leukemia, where the treatment usually ends up going into cure. What causes leukemia? Well, leukemia on a broad spectrum, a lot of things, maybe nothing. Speculations about if it is your environment, lifestyle, maybe you drink and smoke too much, or you get it from your parents too, which is also, there's data that would suggest that it can be genetic. And in my personal case, when I was speaking to my doctor, he told me bad luck. He said he couldn't tell me exactly why I got the cancer because nobody knows exactly. But you can maybe think it could be with lifestyle or genes. More research is done on curing the disease than the cause. We do know a lot about how to treat it, but we don't really know much about where it came from or how it started. The breakthroughs in research are very recent. Used to be a death sentence. The history of leukemia is we probably have had leukemia as a species since we first came onto land. I mean, I'm sure that all sorts of animals can develop leukemia. It's a fairly common cancer for humans, at least. And so it's probably been going around killing people who don't know that they have leukemia for centuries until more recently. So today we have a high survival rate, but we used to always die from it. And so as far as discovering leukemia, there's a handful of doctors that I've listed here who've all found little tidbits about what this disease was. They would have patients who died with excessive white blood cells, and this is two centuries ago. So when they went to come together and collaborate and put their data together. One doctor says, hey, yeah, this man's blood was very thick. And another one says, oh, hey, well, look at all of these white blood cells that aren't supposed to be here. And so, not a whole lot of information on who discovered leukemia. It seems to have been multiple different doctors with different patients and kinds of leukemia. T cell or B cell? Most of ALL is type B. The kind I had was type T, and when I first went in, the doctors thought I had type B, but the guy oncologist I had was very smart. His name was Dr. Godwin. He was able to find out it was T through further testing. I'm not a doctor. I mean, perhaps there's simple ways to tell the difference between the two, but anyways, T cell is more common in young males, which was my age group at the time. I was diagnosed when I was 22 years old. Prognosis and treatment of these two differs a little bit, but they are still both relatively good cancers to get as far as cure rate goes. So when we go back to our blood chapter from 231, page 665 in our textbook here, you can see that leukemia can originate from any of these um, Or any of these states of differentiation, you can have myeloid leukemia, which is also fairly common in children. Actually, this is the one that a lot of research has done. They've come a long way with all of these leukemias, but each one requires just a little bit different doses of this medication, this chemotherapy. They're all different in their own complex medical school kind of way. So what I had was over here, lymphoid stem cell. There's the research suggests that the cancer comes from this, the stem cell. Um, but also it could, well, or this precursor, I should say, B or T cell, right? Like, I mean, it can, I supposedly it can come from anywhere, but the cancer I had, they believe that it came from the precursor of the T lymphocyte. We don't know that for sure, but that is what is commonly believed, that this precursor here proliferates and makes a bunch of these cancerous cells. One way to think about it. That would be the morphology of this. So anyways, the pathophysiology, like many cancers, it's not initially painful. Fatigue, pale skin, night sweats, and tumors often portrays as a mediastinal tumor, which for me, that's what it was. There was a giant golf ball sized tumor between my heart and lungs in the mediastinal spot. And they biopsied it and found one of the highest concentrations of lymphocytes they'd ever seen. They believe it came from a lymph node, possibly. That's possibly where the tumor originated from, and thus the cancer. But like I said, they believe it might originate in the blood bone marrow. But the mediastinal tumor suggests that this type of cancer would start in a lymph node, like lymphoma, which would suggest that I had lymphoma, not leukemia. So you see, it's just a very complex disease here, leukemia in general, and the diseases that are similar to it. So yeah, it's like I was saying earlier on the page there, that the lymphoblasts are the precursor cells, the stem cells, uncontrolled production of them, and then you have these white blood cells. They circulate throughout your whole body. They're already in your blood, unlike many cancers where you have a tumor that stays in one spot. This type of cancer basically goes from stage 1 to 4 because it's already widespread, but luckily it doesn't really attach to other body tissues very often. It's not going to go and metastasize in your liver or your brain or your kidneys. Very likely, it's not very likely that that will happen. It's possible. So when they dose you with excessive amounts of chemotherapy, it really does a good job of targeting the cancer. But yes, if it is left untreated, death is all but guaranteed very quickly. Don't think I've heard of anybody surviving having upwards of 100,000 white blood cells per deciliter without some sort of chemotherapy. I think once you have that much excess, you are going to die. Modern medicine may not know very much about what causes it or where exactly it starts. Yes, and yeah, so today we know much more about how to treat it, where the cancer likes to hide. So, you want to do your chemotherapy, obviously, it kills the cancer cells during the stage that they reproduce. It's really good at targeting fast reproducing cells, so that's why your hair is likely to come out too and have a lot more other uncomfortable side effects with that. Steroids too, anabolic steroids help to suppress the lymphocytes, so your body isn't producing as many of the cancerous lymphocytes. So that's why they dose you with steroids. And you're going to need antibiotics because your neutrophils are going to be next to zero during the initial part of treatment. Um, Radiation, because this cancer does have a tendency to hide inside of the skull after you've been cured, and then 6 months later you get tumors in your skull and then a relapse, so that's not fun. So yeah, you'll get some radiation, then your hair might fall out the rest of the way, and of course much more, because cancer is not very easy. So a little Providence my chart of what my doctor was how my doctor was describing me here. So this first picture here, this is before the radiation. You can see that I was losing my hair a little bit here, as very thinned out. My muscle tone was lacking. I had a PowerPoint in there that went straight into my superior vena cava. Might have been superior vena cava, or it could have been, yeah, I think it was the superior vena cava, something in that area. And then after the radiation, yes, I had to shave my head, and then just like a little bit would grow out at a time. And um, so as the doctor said here, this is about a year into my treatment. I was diagnosed at 22. So yeah, it started out with the progressive fatigue, and I had this cough because the tumor in my chest was pressing against my lungs, and so it was a physical blockage causing me to cough. And when I went to get an X-ray, there was the mediastinal mass, which had the hyperleukocytosis. Now, this isn't pertaining to the blood. I think this is just pertaining to the biopsy they took of the mass. So, although my blood counts were fairly, very, very high in the hundreds of thousands, I don't think this is what was in my blood, but it was. But you could imagine that, yes, my blood would have followed suit. My white blood cell count would have followed suit in any other test too. And I had fluid that would fill inside of my pericardium. Wasn't sure what was going on there. Maybe it had something to do with osmotic pressure of the cancer cells sucking in water. There's plenty of, but that's not what the doctor was worried about. The doctor was worried about just draining that out and treating the cancer. He didn't really care why the cancer gave me a pericardial edema. What would you call it? Fluid filled sac there. So yeah, they found out it was TALL, and and it was in the pericardial fluid. So maybe those cancer cells were sucking fluid into the pericardium. So so the initiation of chemotherapy, I had so many cancer cells die that they clogged up my kidneys. But other than that, I, yeah, apparently tolerated the chemotherapy well, obviously because I'm still alive and that cancer is no longer detected in my system. But there was 2 trips to the ICU, and then and then I have a low immune system, so opportunistic infections would come upon, and I would get maybe fungal infection in my liver that would cure after I got healthier. My immune system was able to take over, and yeah, so that was my long journey of acute lymphoblastic leukemia. And thank you for looking at my report. Okay, there's my sources.